to relocate now to enjoy the 45 minutes.
The members of the panel, my senior colleagues who are present here and those online. And specifically, I want to recognize the Deputy Joint Staff Health Services, Brigadier General Chen, who is online, and by the Director, Lieutenant Colonel Masimu, and all the senior colleagues who are present here for this defense. As they said, my name is Mwewaze Nicholas, and my supervisors have been introduced. I'm presenting implications of aerobic exercise on clinical outcomes of HIV positive clients in Uganda, the case of General Military Hospital, Bombo. AIDS was diagnosed in Uganda when it was declared in 1981. It brought a lot of changes in the quality of life of people. The body now becomes susceptible to many illnesses, what they call the opportunistic infections. And now it weakens the human body. In 2022, UNAIDS said that HIV is one of the most serious health issues facing the world, and about 7.9 million people were living with HIV by 2019. Africa had the lion's share, where 25.7 million, which is about 2/3 of the total people living with HIV. In Uganda here, about 2.5 million people have died due to HIV, and 1.5 million are living with it and on care, and some don't know that they have it. Uganda is one of the countries who are fighting to ensure they end HIV by 2030. However, there are still new infections. For example, in 2018 alone, 1.7 million people were diagnosed with HIV. And out of those, 1.1 were from Africa and 53,000 were from Uganda. The advent of ARVs brought some ray of hope to people who are HIV positive, because these ARVs, when they came, they improved the quality of health for people who are HIV positive. It increased life expectancy for the infected people. There was reduced mortality and morbidity. And the current studies also indicate that there is reduced transmission, what they call U equals U, where when one is virally suppressed, may not necessarily transmit the virus to someone who is HIV negative. However, these drugs, they come with regular visits to health facilities by people who are HIV positive. They have to come to the facilities monthly, or every after 3 months, or every after 6 months. And this indicates that there is a cost in terms of money which they spend on transport and time. And in addition to that, there is a cost to government for these drugs. It is estimated about 250 to 550,000 for an adult, and about 200,000 for children who are on treatment. In addition to this, there are side effects which come with these drugs. And of course, as people get treatment and prolong life, the effects of aging also come in. Some wonder drug which you take one tablet called DTG now, it is one of the drugs that predisposes people to non-communicable diseases. All these now affect the immunological competence of the HIV positive people that are on treatment. This now needs a multi-sectoral approach in order to reduce the effect of these comorbidities, which are caused by the infection itself and also the drugs that they take. These approaches can prevent infections, reduce the pill burden, because if someone gets non-communicable diseases like diabetes, they are on HIV treatment, it means that they are going to have additional pills and more visits to the doctor to ensure they survive. And if these approaches are also taken, they are most likely going to increase adherence to ART, because when they are taking few drugs, they are likely to uh, take their drugs well. Aerobic exercise has been found to deal with most of the symptoms and complications and side effects of these drugs. Exercise reduces the number of HIV-related side effects like the cardiometabolic and morphological problems that come with highly active antiretroviral therapy, such as inflammation, oxidative stress, mitochondria dysfunction. Usually when people are not active, there is what happens in the body, mitochondrial degeneration, which affects their well-being. This aerobic exercise, therefore, can improve the quality of life for people living with HIV. Some studies, like the one of Madwangu, indicated that people who were exercising had more CD4 cells by 107.5, and than those who were not exercising. Then aerobic exercise also have been found by other studies to prevent the onset of those non-communicable diseases, which come with increasing pill burden and the regular visits to the facility, meaning costs. Aerobic exercise contributes to improving clinical outcomes like the neurological measures, which is commonly measured using the CD4 cells, ensuring people have ability to do their work without undue fatigue, which is one functional work capacity, measured by using oxygen consumption, and also the psychological markers. The common ones are paranoid ideation, depression, neuroticism, anxiety, and phobia, which were actually looked at in this study. Despite the evidence that has been highlighted of the benefit of aerobic exercise, clinicians in Uganda do not emphasize the use of aerobic exercise for people living with HIV. There is scanty literature on the effort to encourage PhD in Uganda to utilize aerobic exercise therapy as an additional therapy for treatment or management of HIV positive people. HIV infection, though there are some scientific breakthroughs, it still has no cure and the prevalence is still high. The ARV medication prevents the virus from replicating, and the spread, but we still see advanced HIV disease, which continues to be a challenge in worsening the illness and also increasing mortality of people living with HIV. Advanced HIV disease is when the patient or the client has less than 200 CD4 cells, meaning they are susceptible to any opportunistic infection. So as people HIV age, they are also prone to non-communicable diseases which affect their immunity, and the side effects of ART and the infection itself continue also to affect the people with HIV negative. Aerobic exercise is one of the interventions which is recommended, and this evidence was based on studies, mainly on data that was done and clinical observation which were done from other countries, not Uganda. The HIV treatment guideline, which is a pillar of HIV care, highlights aerobic exercise as one of the interventions. However, it lacks details regarding how these aerobic exercises should be given and also how they should be administered and the benefits. The clinicians have no exercise guide, and this study may be the first to provide published evidence on the role of exercise in improving clinical outcomes for PLHIV in Uganda. The aim of this, therefore, was to provide knowledge and skills required for using aerobic exercise in managing HIV positive people. The study was guided by the main objective to establish the implication of aerobic exercise and fructose and insulin. It reduces the stress hormone, which is cortisol hormone and epinephrine. This helps in reduction of inflammations, neutrophil and monocytes, and it helps in increasing lymphocyte saturation as well as cell recruitment. It's said that lymphocytes will saturate in the body after exercise for more than 3 hours. So if there is any stun infection, someone can get very quick response. This graph shows us the pretest of the functional capacity, and this clearly shows that the performance of both experimental and control group. The experimental is black and control group is blue. It clearly shows that it was almost the same. And now this graph shows us how the experiment guidelines and also retooling clinicians and counselors in order to support in ensuring that people living with HIV do the exercise, and also encourage regular participation by both clinicians and clients. The reason clinicians are stated, studies indicate that where clinicians are doing exercise, they are most likely going to encourage others. Ministry of Education and Sports should incorporate exercise psychology into exercise physiology into clinicians training, and partners on HIV care should also improve on promoting aerobic exercise. This can be done by incorporating this to ensure, because patients, they have a lot of trust in the clinicians who see them, and when they don't know, when they don't have good idea, they will not have confidence in supporting the client. So if they are retooled, they are most likely going to implement. Exercise science should also promote policies and programs for care providers and people living with HIV. So after this, if I get that big name, I'll write a policy to suggest to Ministry of Health to also include physical aerobic exercise as a therapy to support ART treatment. Now, their publications, the first one was out by 30th June, and it has been downloaded more than 200 times. It's very interesting. Then the second one has been accepted, and it's waiting publication. The third one is under review, and 2 papers were presented in the 8th International Council of Health and Physical Education and Recreation and Sports and Dance, which took place in Kenyatta University. So all the requirements are met. I acknowledge this big list of people. I am sure I'll have time to acknowledge them verbally. I want to thank you for listening. Asante sana. Mungu awabariki nyote.
Thank you so much. Now that's the meaning. So thank you. Another round of applause for Miss Kapodan, where was Nicholas. Up here, I think I want to accompany you a little. The rest, others, the professor wants. Go ahead only on HIV. So the motivation for going HIV, not overweight, obesity, and related hypertension. Lastly, I hope this doesn't belong to the opponent.
Thank you.
The lead discusser.
Thank you, sir. I think the number one NCD in in Uganda is diabetes, because it takes a budget of about 2.2 billion from government alone. And you are aware that most of the people who are diabetic get their own treatment. So it's the number one. And of course, followed by hypertension. Yeah.
Did you answer that? But leave it. Thank you so much. I think you are now proud, praying a little bit to answer your questions. You have about 30 minutes to engage with the lead discussant, Professor Nampa. It's your time now. Thank you.
Your latte has given you part of my questions. Okay, I want to thank you, Nicholas, for the good work. It's really comprehensive work. And I want to thank the supervisors for moving with you in this long journey. I know it is full of mountains and valleys, but you're able to achieve your destination. And I congratulate you for getting the PhD at the moment. Yeah, however, I want to ask you a few questions. I'm not asking you to enable the public understand what we in sports science do and what we are able to do beyond sports science and exercise. There's a lot we can integrate sports science with medicine, we can integrate sports science with the social science and so on. So we have a lot that we do. So my first question is about your motivation. What motivated you to do this study?
Thank you so much, Professor. I wanted to start with this story, but when they restricted me on time, I said maybe let me ask. One day this is a true story, I was working in one of the villages in Uganda, and I met this colleague of mine. He was on the foot of a hill, looking at it. It looked insurmountable to him. I asked him, what is it? In Kiswahili, we say, Shidagani. He said, I used to run over this hill before I got sick, but now I cannot manage, and I want to run. I told him jokingly that walk instead of running. So I went, I left him, but he walked halfway. He continued going there and walking. After some time, he could run and finish the hill. Going to see him, he was back in the football team, able to play football. And it gave me a lot of questions. So this study is about the story of that gentleman who was challenged by the disease and treatment and unable to do his work, but he started the walking and was able to go back to his feet.
What was the science behind that?
The reason that there was no science, that's why I didn't write it in the book, but I'm telling you the fact of the story.
Sure. Because he started with walking.
He started with walking. And then after, he was able to run.
And then?
And he was able even to run better the way he used to be and went back.
Yes, so what happened to his muscles?
It means that there was recovery of the muscles. He developed cardiovascular strength, muscular strength came back, and he was able to perform better.
Thank you for that story. So how does your research contribute to the existing knowledge about the management of HIV, specifically in the Ugandan context?
Thank you, Prof. This study now brings in an area that has not been explored locally here. I've been in HIV care for more than 20 years and I'm a national trainer. This has been lacking. Now it brings it in. When you look at the HIV care and treatment guideline, there are areas where they write the word do exercise. And that's where they stop. And this is said to a clinician who doesn't have an idea on exercise. And now what they tell these people also is do exercise. I was one time in a gym someone who had diabetic and was already emaciated. They said, do exercise. He went to the gym. What the gym attendant did, he gave him weights. With very weak muscles, he was trying to lift the weights like this. I didn't see him again. So this is the idea now this study is bringing in to now supplement the use of ARVs and other interventions in promotion of health in HIV positive people.
In that aspect, how do you advise these gym people? Don't you think they're destroying people?
Yes, that is true, and it's a discussion that we had at the departmental level, where we are in the process of developing short courses for these people to retool them and make sure that they have the knowledge and support. There are many people who became disabled, ladies who developed muscles like men from the gym and because of the wrong approach.
Now, with your idea of introducing aerobic exercises to these sick people, HIV patients, what caution do you have to protect these people from injuries?
Thank you, Prof. We don't call them sick. They are only HIV positive, but they are okay. The caution I have is that they need professional guidance, because if they are not handled professionally, they may get the negative effect of exercise. You know that some of them are already having weakened bones because of the drugs, and therefore they need to be handled professionally.
How will you go about that?
I think I said earlier that we are going with the support of my supervisors to develop a policy brief to the Ministry of Health and suggest it. But you know, policies in Uganda, they have a new terminology there in policy development, what they call BIBs, brokers, intermediaries, and boundary breakers. So even if you have a good policy, you need the BIBs to ensure that they go, but we shall do our best.
So let's go to the next thing on research design. Why did you choose was experimental study rather than RCT?
Rather than RCT, what is RCT?
The random.
Okay. I was asking for clarity and I got it. Thank you, sir, Prof. Thank you, Professor. I think quasi experiment has a high level of external validity compared to RCT. It's one exercise adherence is one of the biggest challenge we have. Most people know the benefit, but exercise adherence is a very big problem. Now, there are new innovations that we are trying to use here. They are new in Uganda, where we do assessment and provide lifestyle modification. We hope that those, because we tell you how you are in terms of your body composition, your metabolic age and what it means, and we give you adherence counseling.
Thank you, viewers, those with your answers. And somebody take
The layman. I see people dancing, blah blah. What are the benefits of those exercises?
Thank you for that question. Aerobic exercise are basically defined as exercise of moderate or low intensity for a long duration. And during this exercise, there is use of oxygen. And it is one of the best exercises if you want to burn fat. I know most of the people, their concern is fat mass. So if you use aerobic exercise, if you do it for more than 30 minutes, for 30 minutes and above, you are going to burn the fat, not using the glucose that is in the muscles, but you go and encroach on the fat, and it can help you balance on your weight, on your fat mass.
Answer as we go.
Volume of oxygen.
Down what? Volume of oxygen.
Depends on how you use it. When you the VO2 stands for volume of oxygen. Now, when you talk about VO2 max, it means the volume of oxygen that you consume. Then there's also VO2 peak, which is the volume of oxygen which you consume when you're at the peak of the exercise.
Thank you. Are there other types of exercises other than aerobics that you know of? Answer.
Yes, sir.
Give me one or two examples.
There are basically two types of exercise, aerobic and non-aerobic.
Why did you choose aerobic? It's good you have mentioned. So what motivated you to go this side of aerobic? And you know what, non-aerobic, do you think it would have been good to have another experiment? Aerobic, non-aerobic, and a control? Or this was good enough?
Aerobic exercise is the best because non-aerobic exercise, it is high intensity and it has a negative effect on the immunity, even of people who are not HIV positive. Now, when you give it to HIV positive people, you are likely going to worsen their situation. So that's why aerobic exercise is most preferred. And when you are improving health, it is the best in improving like body composition, cardiovascular strength, and endurance.
Thank you. Don't clap yet. So I know when you are in charge of the experiment, you control, the 30 minutes, 3 times a week. I don't know how you control the other sources of variation to ensure that the results we are seeing here are accredited to the exercise experiment treatment you employed. You understand my comment? For example, I exercise 30 minutes, but somebody may walk for 1 hour going back home, another one walks for 15 minutes. Are you sure that everything we are seeing is only attributable to the 30 minutes aerobic exercise 3 times a week, or there could be other confounding factors, variables, which you had to think about, which could influence these results?
Thank you, sir, Prof. I think I didn't know we were in questions. But one of the assumptions, first of all, the exercise we do in our daily routine reach a time when they cease to be exercise because there is a principle of variation. Now, when you bring in a different exercise, it will definitely bring a change. Now, one of the assumptions was that these people will remain doing what they were doing and they get an addition of that aerobic exercise. And therefore, that's why we think it improves.
Actually, don't spoil your answer anymore. That's good enough. Why Bombo? Because Mbuya is just here. And if you wanted a military setting, I thought Chambo and Mbuya are more close to each other. Is this where you were born or the other reasons?
Thank you, sir. The reason Mbuya is a small facility, it is a level 3. Second, the Bombo, as I said at the start, it is the the referral for all military facilities. And as I said, it is a unique facility in that even the neighborhood, the people who come from the community, you will find they represent every region in the country.
Thank you. Why 12 weeks? Do you think you'd have got better results if you had stretched up to 20 weeks? claiming, okay, let me stop.